side, all at the same time. He is a fierce contender. Let's play it. Michael Shapcott.
Time to talk about planning and zoning. Michael Shapcott from the Wellesley Institute. At the Wellesley Institute, we're interested in health and we're interested in equity. Our interest in health comes naturally because our legacy institution is the old Wellesley Hospital. Some of you may remember it. This is 1912, history lesson. Sir Wilfrid Laurier, Prime Minister of Canada, founding of the Wellesley Hospital. Remember this guy, Dr. Herbert Bruce. We're going to come back to him in just a second. In 1912, Toronto at the start of the 20th century was horribly unhealthy. Poor immigrants were crowded into terrible slums in the very shadow of Toronto City Hall. Toronto Medical Officer of Health, Dr. Charles Hastings, was ordered to do something, to do anything to improve the city's health. So he said, let's focus on the fundamentals, and one of those fundamentals is housing. He built the city's first affordable housing project, Spruce Court Apartments, in 1912. Thanks to his pioneering work, the health of Torontonians improved substantially. Let's fast forward to 1934. Our friend Dr. Bruce, he's now Lieutenant Governor of Ontario. At the 100th anniversary of Toronto's founding, he gave a speech and he called for an end to the slums in Toronto. The slums that were giving us a terrible combination of poverty, poor housing, poor health. The Bruce Commission said we got to get rid of Toronto's last remaining slum, Moss Park. Open sewers in Moss Park. Replace it with modern housing, modern conveniences. The health of Toronto improved. Fast forward to 2010. We're a horribly divided city. We have rich Toronto and we have poor Toronto. And these divisions are not just in terms of income, but they're divisions in terms of our health. Rich Toronto, this is a map of diabetes in Toronto. The darkest areas, the areas with the worst prevalence of diabetes. Poor Toronto, poor housing, lots of diabetes. Rich Toronto, good housing, diabetes very low. But it's not just diabetes. There are 39 indicators of health that the medical officer of health has said that inequality costs us. It's costing us 1,100 premature deaths annually in the city of Toronto. It's a 16-year wait in this city for people to get a house on our affordable housing waiting list. Core housing need, the most significant indicator of precarious housing in the city, is up 83% in 15 years. But it's not that we've forgotten how to build housing in this city. We built lots of boutique residences from $2 million up. We're building lots of housing in this city, but we're not building the right kind of housing. We're not building housing for low, moderate, and middle-income households. Now, what we need in Toronto is we need a home for everyone, everywhere in Toronto. Very simple. That's our vision for a healthy and equitable Toronto. And I have some good news. We actually have a very simple solution to it, and the solution comes from the United States. Hundreds of U.S. cities already have inclusionary housing, inclusionary zoning policies. There's strict rules that say every new development has to have a fixed percentage of affordable housing. Lots of U.S. cities have it. Here in Toronto, we have some good developments. A project that we worked on, the Wellesley Institute, inclusive. We have St. Lawrence neighborhood, an inclusive neighborhood. But there's no rules that say developers have to include that in every neighborhood. And so what do? They build for middle and upper income people. They don't build for people that need it. So what we need in Toronto is we need city councils to create detailed inclusionary zoning rules for every developer in every part of the city. And we need our Ontario government to give the city permission to do that because that's the way the rules work. But once we do that, we can start to link inclusionary housing to lots of other city building initiatives. Transit City, Tower Renewal, Waterfront Toronto, all going to spur growth in the city. We need to make sure some of that growth is good affordable homes for people like you and me. So in the election of 2010, we need to vote for a healthy Toronto. We need to vote for an inclusive Toronto. Vote no for NIMBY, for people who want to keep affordable housing out of neighborhoods. Yes to inclusionary housing. Yes to inclusionary zoning. Thank you very much.